City, okay? You all have seen Snap City. It's when you're in the gym and you're watching someone over in the corner and you're looking at their technique and you're being like, oh my God, they're gonna die. They're gonna die if they keep doing that. But you don't wanna be that person that goes and like corrects their technique. You don't wanna be that person. But anyway, this is, and sorry for the quality of images, the internet doesn't actually have heaps of this. But look, this is kind of trying to show that maybe if your hips are level, your spine will stay straight and it'll be good. And this one's kind of trying to show that if your hips tip forward, that you're gonna get this kink in your spine. And this lady here, I don't know what she's doing. Look at that curvature, right? You think about gravity coming down, pushing that weight down, and it's all going on the middle of her lower back. Can everyone see that? Yeah, and that's got really big ramifications for totally wrecking yourself. And it's why things like squats and deadlifts get a bad rep, because people do it in this position and they wreck themselves. Squats and deads are the safest thing you could ever do if you know what you're doing, okay? Here's the big scary one, and this is the only big issue that I'll talk to you about because it's really good news, okay? Not having a disc issue. Having a disc issue is not great. But who here has had a disc issue? Who's been diagnosed? 1, 2, 3. Okay. How long ago? Can you tell me? 10 years. Okay, back then were you told that you were pretty much stuffed and it wasn't going to heal? Yeah? Yeah, and that was a young one. So the young guy told me that that's healed himself. Awesome. So myotherapy's got a really good rep now because we're actually a lot newer. It's only been around for about 20 years and we've actually got a lot more up-to-date stuff than some of the old tertiary systems. 10, 15 years ago, if you did a disc, you were considered totally stuffed, right? They don't ever heal, you gotta have surgery, rah, rah. And that's what people don't realize, that in health, moods change. People change their minds about stuff. So now we know that disc issues heal by themselves. That was like unheard of 10 years ago. Like we just didn't do that, right? And we also, there's a really famous study on these people with back pain, and they took 100 people with back pain and they gave them to these radiologists and they scanned them all up. And the results came in, and it said like 95% or 95 of these people had moderate to severe disc issues. But the test wasn't on the people with the back pain, the test was on the radiologists. And in actual fact, not one of those people had actually experienced back pain in their life. They actually got all these people with the miraculous one, said, I've never had back pain, got them scanned. And so what they worked out was that actually all this structural stuff we're really scared of, it's not what we thought it was. You can have totally wrecked discs in your back. And the back pain, we think, is actually really coming from the musculature gripping on, and that this is all secondary stuff. Yeah, so that's good news about discs. We're not as scared, and you see very, very rare that we will actually operate on people's lower backs anymore. And I get clients in their 40s and 50s all the time that have had operations that now would not take place. Okay. Now this one, and we're very close to done. You've all been really good and patient listening to me. Now this squat, you're probably all thinking actually looks pretty good. Okay, she's like nice and upright, and she's looking strong. And she's got some weight in her heels and stuff. I mean, this is more subtle, but it's still a problem. You've still got the curve in the lower back. Can everyone see that the spine's still curving back up a little bit under the weight? And with this squat, and this is what we deal with heaps in our clinic, we get a lot of weightlifters through and CrossFitters and that kind of stuff, as well as people in pain. This thing you'll get away with for ages. Like you'll do this for like 10 years and it'll be totally fine. You'll get stronger and stronger and stronger, but what will happen is that you'll fall into the trap of a lot of people in that they're getting stronger, they're getting fitter, but they're still stiff. They're still getting stiffer as they get older. They're still waking up not feeling as fresh, and they're still having bouts of back pain even though they're in the gym all the time. And again, you've still got that. But if you're getting depressed because I'm showing you decent squats and telling you it's no good, get more depressed because I'm going to show you what perfection is meant to look like in a person.